And welcome. We're really glad to welcome you to this public health update. It's hard to believe, but in just a few weeks, it'll mark 2 years that we began these regular updates for the community. And none of that would, of course, be possible without Dr. Lisa Santora, who's with us tonight, and her colleague, Dr. Matt Willis, our public health director, who have really made an effort every step of the way to keep our community involved and informed as we make very important decisions related to the health of our community. I want to mention that this webinar is being recorded and is going to be available on our Rethinking Schools website. The webinar is also being presented in English with simultaneous Spanish translation. Thank you very much to Marta Beton, who is our interpreter this evening, and Michelle Drake will now share with our audience how to hear the webinar in Spanish.
Thank you, Ken. Hola y bienvenidos. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Marta Beton, que es nuestra intérprete esta noche. Thank you. Gracias.
So we have a lot of information to cover, and as always, there are updates, and this evening we're going to be covering just a general status COVID-19 update for our community, as well as updates to our 32-point plan and other guidelines as we discuss them this evening. We, of course, will be having questions in our chat, and or our Q&A, and we will take those questions at the end as time allows to gather more information. So I'm now going to turn it over to Dr. Santora.
Thank you, Ken, and thank you to both our Office of Education and Public Health teams for getting us ready for tonight. They have been tirelessly working always around the clock and behind the scenes to keep our schools open. I'm always indebted to everything everyone does, big and small. So you can jump ahead. I do have good news, but it's interesting providing this good news. We continue to see a significant decrease in cases. We have had a couple of days where we have had less than 100 cases per day. If you had talked to me at any point in the past 2 years, 100 cases a day would have been a whole lot of cases and very high transmission. With Omicron, we have adapted to a new normal of having a very contagious variant circulating through our community that is having effects on our healthcare system and residents. Fortunately, because of our high vaccination rates, and it is a milder variant, but not to be deceptive, it is still causing hospitalizations and moderate to severe illness in some. We have been able to keep schools open and continue towards adapting to a new normal, which is still an ongoing journey, but we are headed in the right direction down. I don't anticipate that we'll reach the orange or substantial levels of transmission until the end of this month, and don't expect us to reach moderate or yellow transmissions. And if you remember, those are the CDC categories of transmission until March, early March or mid-March, but we are headed absolutely in the right direction. Jump ahead. This is just to show consistently that unvaccinated persons remain at higher risk for infection from COVID-19. I know many of you have had vaccinated and boosted persons in your families who have become infected, but if you are unvaccinated, you're still 4 times greater risk for becoming infected, and boosters have a protection rate of around 50%. You're 50% less likely to become infected with Omicron if you are boosted. But we do know that vaccinated and boosted people are still have a risk of becoming infected because it is such a contagious variant. I often hear that there's concerns around us reporting on our case rates because it's skewed towards testing unvaccinated persons. That's not the case. Since December, we have reported testing in between 2,000 to 3,000 persons a day. The majority of residents in our community who are testing are vaccinated and boosted residents. So there is not skewing of this data to over-represent the transmission rates among vaccinated persons. What we have experienced, though, is a shift from PCR or molecular testing that gets reported through laboratories to rapid antigen testing. So many of our residents are finding out that they are COVID positive after an exposure or with symptoms because they have access to home-based antigen testing. And that is not part of what is typically reported or under surveillance with through public health. which is why you've seen in past presentations, we are going to increasingly rely on systems like wastewater surveillance to detect increases and changes, not only in the amount of COVID circulating in our community, but even potential variants. It's an emerging technology that we're finding very useful. You can jump ahead. As we talk about having a highly protected community with vaccinations, we have to recognize that there's still great disparities in vaccination rates in our community that puts our community at risk and some of our vulnerable populations at risk. We have disparities in our booster rates among residents from communities of color. We've seen also disparities among the primary vaccine series among children 5 to 11-year-olds. And so, but public health is going to be transitioning during this month from mass vaccination efforts, which increase the availability and accessibility of booster shots and primary vaccinations for our general population. We'll be partnering with our community partners, including federally qualified health centers and community-based organizations, to increase education and outreach for populations that remain under-vaccinated in our community. We have seen consistently across the nation and the state that communities of color are disproportionately represented in hospitalizations and deaths, including our community. And so we are committed to ensuring equitable distribution of vaccines in our community. Jump ahead. This is an update on our schools. Just showing the data that we saw during this winter season of Omicron, you'll see that the highest case rates we're seeing among the 12 to 18-year-olds. And that's very consistent with the booster rates among that population when we launched into the holiday season, as well as waning immunity. We've had a community that has readily accepted the vaccine. And so our 12 to 18-year-olds were first in line to get vaccinated in May and June when they became eligible. That means when Omicron hit this winter, right before our holidays, there was a significant amount of waning immunity, which resulted in those higher case rates among our 12 to 18-year-olds. And interestingly, you'll see the 0 to 4-year-olds, which remains an unvaccinated population, continues to have lower case rates than even our 5 to 11-year-olds. But the 5 to 11-year-old, that's the red line represents to me, is just to remember that while we have around 79% of our 5 to 11-year-olds countywide have received their first dose, we still have 20% of 5 to 11-year-olds who remain unvaccinated. And as I described in an earlier slide, among our Latinx community, we have significantly lower rates of primary vaccine series completed in 5 to 11-year-old population. And we also have lower rates of boosters, which all contributed to having a higher case rate among 5 to 11-year-olds. And with children 0 to 4, around 50% of those children are in childcare, which puts them at higher risk for potential exposure to COVID, but also half of them are at home. And so probably are cocooned and not exposed to COVID-19 at the same rates as other children in our community. So this is just a picture, and we really are fortunate to our epidemiology team for being able to provide us such accurate and up-to-date local data to inform our policies and the recommendations that we make, especially for the school age population and childcare population. Jump ahead. So we've also updated our school dashboard. You'll see on the left-hand side, we are continuing to emphasize our vaccination rates, and we'll be updating that to have the percent of staff who are boosted. We don't have that yet. If you've been tracking our county school status on the right-hand side, you'll have seen week after week, we've seen decreasing number of cases or active cases among school-age children in our community. And again, that's just consistent with that first slide that I showed, that the rates of COVID-19 are decreasing in our community, although they still remain high. So we've consistent week after week are seeing decreases in COVID activity among school-age children in our community. And we've seen, if you look from week to week, testing is an important tool for us. That's that top right-hand corner. We kind of stalled out on our access to home test kits. We were ahead of the curve because we got an order in very quickly to get 40,000 kits to come into our community for distribution prior to the holiday season. What happened when the federal government shifted to every home receiving a kit? It decreased some of our supply for home-based antigen that the county can distribute. So we are working to identify a stabilized source of public health funded rapid antigen tests to continue to distribute to our community. And that's part of our partnership with the California Department of Public Health and the school division there. But we also are encouraging residents to secure their own rapid antigen test and have a supply of rapid antigen tests at home. The manna that we had previously, we don't anticipate to have the same supplies of public health directed rapid antigen tests. So if you can secure rapid antigen tests, we highly encourage you to do that. And everyone, maybe someone on my team could put in the chat the web address to request a rapid antigen test kit to be sent directly to your mailbox. That is one of the best ways we can get more test kits, free test kits into our community, is if every resident in Marin County requests their allotted rapid antigen test kit through the federal government. So encouraging everyone to do that, because we don't know when we will have another gift of rapid home antigen test kits coming through the public health division. Jump ahead. So as many of you, if you're on our calls previously, we have updated our 32-point plan. Even though we still have high rates of COVID transmission in our community, we have climbed that mountain of Omicron, and now we're coming down the mountain, which allows us to relax our recommendations. More importantly, what's allowing us to relax our recommendations is that we have consistently seen, since the return of school in 2021, that schools are not an environment that support COVID-19 transmission. Our school districts and students and staff have all worked together to successfully implement a layered mitigation strategy approach, which starts from not going to school when you're sick, to wearing masks in schools, to other strategies to prevent COVID transmission in the school environment. And that continues to show successful even when we have a more contagious variant like Omicron. So our goals are not only keeping schools open and all students in school, full-time in-person instruction 5 days a week, and unless they have half days or some days off, which I know are upcoming. We also recognize the critical importance of creating environments where students thrive, and how important sports and extracurricular activities are for the social and emotional development of our students. So we're really striving to have a balanced approach as we navigate the end of this phase of the pandemic and transition into the endemic phase, which we're not quite there yet. We know this is a more contagious variant, so we're still seeking to slow the transmission of this variant, which is why in the beginning of the year, we had much more restrictive recommendations. We have relaxed most of our recommendations except for outdoor masking, and we'll continue to relax as permitted by the state. It's really important to know, I get a lot of communications from the public that we are operating under the governor's state of emergency order, and the K-12 guidance that we have from the state is under that emergency order. So we do not have local orders as it relates to the state. When you see the 32-point plan, it is mostly a digestion of what is allowable by the state and to make it user-friendly for our schools and districts. And we will continue to relax as permitted by the state. I know the one thing that we are looking toward is further relaxations in quarantine. We have really optimized, unlike other school districts across the state, we really have optimized the use of modified quarantine to make sure we can keep every student in school because of the low risk we see of transmission in school, even among students who may have been exposed to COVID-19. That is different than allowing students to participate in higher risk activities if they've been exposed. So again, we are seeking to create those environments where students thrive, but we still are striving to have a balanced approach, knowing that we still have Omicron circulating in our community, and we want to keep schools open, and we really have been successful at doing that. And my gratitude to everyone who's been part of that. You can jump to the next slide. So the updates that you may have already seen is that large gatherings are allowed. If there are some large gatherings that have more than 500 persons involved, it has to follow CDPH guidance around indoor mega events, which requires vaccine verification or testing for participation. We updated our language just that staff, students, and visitors should wear the most protective mask that both fits well and will be worn consistently. I've seen some black and white arguments around masks don't work at all. That is not the case. There are the most protective masks, which are the N95 masks. The less protective masks, but still protective, are the KN95 mask, and then cloth masks still offer significant layer of protection. It's common sense when you're covering your mouth or covering your mouth either by covering your cough or wearing a mask that prevents respiratory droplets from getting expelled through your mouth. So, and it also is demonstrated by research that while cloth masks are not as protective as N95s or KN95s, they still do offer significant protection in our school environment. We are encouraging everyone who is eligible, who's going to participate in higher risk activities and these indoor activities to get boosted. We are no longer suspending games or teams due to outbreaks. We are working with our school teams to have individual dispositions based on the vaccination status or past infection status of athletes and staff. And again, our goal is really to optimize those extracurricular and sports activities and not to exclude students if not necessary, to exclude them. And then I just added the link to our isolation and quarantine guidance. This is updated regularly by our team based on frequently asked questions that we get from school staff. So sometimes it's just clarifying language. Sometimes we might provide additional updates based on changes like I described above, that we're no longer suspending games, and we have new recommendations on how to keep teams in play when there's been an exposure event. Jump ahead. Immunity, it's just really important to know that our immunity wanes. This is not a one and done pandemic. We've seen multiple waves of this pandemic, and we've had individuals who at the beginning of the pandemic got infected in March 2020 after months of having some protection from natural immunity that wanes. We have people that have had protection from vaccine acquired immunity that also wanes. There's new research that's emerged from Wisconsin. That's where EPIC, which is a large electronic health record that many of you, if you are connected with Kaiser, some of our other healthcare systems have EPIC as your health record. They did a study of over 36 million patient weeks in Wisconsin, which has a balanced population of vaccinated and unvaccinated, and found that unvaccinated individuals are 44% more likely to get reinfected than vaccinated. And that's why there's ongoing recommendations, even if you've been infected with COVID-19, that you should get vaccinated and boosted at the when you become eligible for a booster. The core vaccine elements, even though there are changing variants, are still effective against the known COVID variants that we have. We do not have a new vaccine yet. That's something that we might expect to see as we move into the fall. But at this point, the COVID vaccine is effective against Omicron, and we anticipate it would be effective against future variants, because if you can imagine a virus, a lot of the changes that happens as mutations happen, it happens on the external envelope of that virus, and all the core components of the virus remain intact. So it might not be as effective as we saw with Omicron. It was not as effective of a vaccine compared to the original Alpha variant that it was developed against, but it remains effective and has prevented significant levels of hospitalizations and deaths in our community. Jump ahead. So just sharing this data, this was recently published in December, where the Commonwealth Fund did an analysis of looking at how effective our national COVID-19 vaccination program has been, and really just looked at the case rates of hospitalizations, deaths, and infections prior to the introduction of the vaccine, and those rates after the introduction of the vaccine program. And it's just really impressive to see the amount of deaths and hospitalizations and also infections, which, if you think about infections, also represent individuals that might contract long COVID or have other complications from having infections, how effective these vaccines have been. We have seen in our own experience in Marin County, there's a new chart on our website that I encourage people to look at. It shows the cumulative death rate in our community, and our deaths just dropped precipitously right after we were able to introduce the COVID-19 vaccine into our nursing home environment in January 2021. We, by January 21, I think we're approaching like 175 deaths in our community. And we still right now are just have turned the corner to over 200 deaths in our community. And again, it just shows, especially in an older community like Marin County, how invaluable vaccines have been to protect not only lives and protect families, but also to protect our healthcare system from surge and allow people to access our healthcare system for some of just the bread and butter parts of life. And that keeps happening. COVID is part of our life, but people still have heart attacks and strokes and that need evaluations for appendicitis. And so it's critical that we keep our healthcare system functional, and vaccines have played a critical role in that. So I just found this really compelling data to share. Jump ahead. So I've mentioned it earlier, we are in waves, and that's the best way to describe the current state of COVID-19 in our community. We are transitioning, and we're expecting a transition to endemic state, but we're not quite there yet. We have a lot of protective factors in our community. We have high vaccination rates, but as we saw with Omicron, we will see that there will be changes in the effectiveness of vaccines over time. We've learned a lot about human behavior, and so as we shift into spring and summer gatherings, it's another opportunity for new variants to increase their transmission in our community. We'll be looking for changes to the variants itself. We were very fortunate with Omicron that it was a much more contagious variant, but less virulent. So we had that decoupling as hospitalizations and deaths from the rate of infection in our community. You're also seeing globally and nationally relaxations of infection prevention policies that will influence how big the waves get when a new variant is introduced in our community. And then also recognizing that we have a number of vulnerable people in our community, not only due to waning immunity or not having immunity because they are unvaccinated and have not had a history of COVID-19 infection, but we're also an older community. So we are at more risk for having future surges just because of the age of residents in Marin County and the limited healthcare, the limits of our own healthcare system, where we have 3 hospitals. So we're not a large community with a lot of hospital beds. We're a medium-sized county. So it's things that we'll be watching as we move forward in this transition from pandemic to endemic. Jump ahead. So there is a realistic probability of another large wave. I remember after our the winter wave, the January 21 wave, it felt so big to me at that point. We had just finalized our first major vaccine campaign that I wasn't expecting Delta to be as significant or as large as it was. And I think that was a lot of hope and optimism, but not grounded in reality. There's just so many unknowns about this disease and this virus, how it is currently spreading in communities across the globe. We've already discussed waning immunity. We live in a time where there's so much global mobility and transportation that really influences the speed of movements of one variant from one part of the world to another part of the world. So I think we just need to approach this with humility. So we are shifting from response to preparedness activities, but it is with great humility in making that shift, knowing that we could be seeing another wave as early as the spring like we saw last year, or it could be just a smaller wave. So I think that's just a lot of unknowns as we navigate, and we have, again, a lot of the protective factors that should stabilize our community and gird us against future waves. And that's really driven by high vaccination rates, high booster rates in our community. Overall, we're a very healthy community. We're the healthiest county in California still. And so those are very protective factors, but remember, we still are an older community and we continue to see disparities in health outcomes among our communities of color, and we see disparities in vaccination rates. So again, we really need to continue to stay humble and focus on preparedness activities as we make this shift. Jump ahead. So many of you have seen the campaign for the urgency of normal. This has a lot of respected colleagues have developed this advocacy approach, which I think is important to inform the state around some, I guess, countervailing opinions among clinical experts. And what I did in this slide is really just to compare a public health approach versus an urgency of normal. I think in Marin County, because we are a highly vaccinated community, and we will be trying to follow the middle path between a more conservative public health approach and move towards relaxing so we really can optimize the environments, especially for students. The first difference is really the difference between having collective responsibility versus individual choice. I had a great conversation today with some school staff, and it really reinforced what I had talked about earlier with some colleagues, of seeing that school is not only an environment for education for students, but it's also a workplace. And so since the beginning of our response to COVID and supporting the reopening of schools, we recognize the critical importance of creating safer environments, not only for students students, but also for staff. And so as parents, one of our responsibilities is really making sure we meet the terms of our contract with our school community and are not sending our students to school sick, and recognize that we are all working together to create the safest possible environment for everyone. Although children and adolescents may be at lower risk for poor outcomes from an exposure to COVID-19, the majority of, or the median age of our school staff is certainly older than 35 years old. And many of school staff may have other comorbidities or be of an older age and have higher risk for having an exposure. So again, I truly appreciate the sense of urgency to return to normal, but we really have to see the environment is not just a student-centered environment, but it's also a workplace where we need to ensure that the school staff are also protected, and we're striving to strike that balance. We're fortunate as to be a highly vaccinated community, but as I described earlier, we still have great disparities even in Marin County. And we are working, our public health priority is to achieve vaccine equity and making sure that regardless of income and race and ethnicity, that we have equitable vaccine distribution. But the reality is we have lower booster rates among our Latinx community, our children 5 to 11-year-olds who are from African American or Latinx families have lower primary vaccine rates. So that is part of the landscape that we're navigating and the conditions that we have in our community. And we do take our approach from public health to address, to achieve health equity and to address disparities. We've talked about masks, which they do offer source control from a public health perspective. And there is data that shows the effectiveness in source control, and then it increases with the mask, that type of mask that you use. And so it's not just only for individual protection. Public health, I think there's an assessment that COVID might be equivalent to flu or less severe than the flu. We see much more hospitalizations from COVID among the pediatric, adolescent, and adult population than we typically see for the flu. We also haven't learned everything we need to learn about COVID. There's long COVID and there's the MISC, the multi-inflammatory systemic conditions that we've seen in the pediatric population. And then lastly, this trying to strike the balance between the group risk and individual risk. Again, as a highly vaccinated community with some schools that are very highly vaccinated, we are aiming to relax policies to optimize that environment in the schools as soon as allowable by the state, but also know that while there is a sense of urgency, we also are public health practitioners and really are striving to be guided by data and science as we navigate into this next phase of the pandemic. So you can jump ahead. So we're not at the end of the pandemic yet. Pandemic is where we are now. It's a global epidemic. We're still seeing increased rates of COVID-19, as I showed on that first slide, above expected. Endemic is when we have expected rates, and the best example is flu. We know when flu is coming. We know what typically the amount of flu cases that we'll see any given season. But also to say that flu is not harmless. We see deaths from flu in our county every year. Not in the past 2 years, because it's been out-competed by COVID, and we see COVID as a much more contagious disease, and some protections that have allowed flu from establishing itself as a seasonal respiratory illness in our community. But even when things are endemic, it doesn't mean that it's harmless or there's not serious illness, hospitalizations, or deaths. So we are in that active transition, and Omicron, due to its contagious nature, how many people were infected globally, it does set us up for shifting towards endemic, and that might be the right description that we might know as early as this fall. But again, we need to continue to be data-driven and evidence-based and have humility as we navigate this active transition from pandemic to endemic. We're just not there yet at endemic phase yet, but we're getting there. Jump ahead. So moving ahead, some of you may have seen this, Dr. Willis presented some of these slides to the Board of Supervisors on the 25th. We have 3 principles as we move in this active transition to an endemic response. It's continuing layered strategies, having a balanced approach, and continue to remain focused on our community. You can jump to the next slide. So we have a lot more tools than we had before when 2 years ago, when this pandemic really launched in our community. Everyone will remember it was Friday the 13th, March 13th, when that was the last day our students were in school in 2020. And we didn't have any of the bullets that are listed on this layered strategy approach. We had a limited foundation of data and evidence to guide our response. Finally, we have case control studies and meta-analyses that are really forming a research basis for moving forward with future public health actions. We did not have vaccination in March 2020. We didn't have a full understanding about the behavior of the nature of this disease and the protective behaviors that we can engage in. And so mask wearing remains important, physical distancing and hand washing. Never overstate how critically important hand washing is and how little people engage in hand washing now. Testing is the tool we didn't have before. Just think about March 13th, 2020, where there was not even a hope of a rapid antigen test in our community. Shift forward to January 2022, when we were able to distribute 40,000 rapid antigen tests in our community. We still need to stabilize the supply of these testing kits, but this is a new tool that we have. And then we are having evolutions in therapeutic modalities, where the treatments we have are not yet like Tamiflu. It took a couple of years for us to have an antiviral like Tamiflu against the flu, but I'm confident we'll have more therapeutics that are available that are FDA approved and effective at minimizing the severity of disease of future COVID variants. So those are layered strategies that are our tools now. Jump to the next slide. We're looking for a balanced approach. We have always approached, especially the reopening of schools, that it is not just the absence of disease that defines health, but is the complete state of emotional, mental, social, and physical well-being, and in the community as well, economic well-being. And so we are striving for that balance. We know there's been harms from COVID policies to our community, both at individual levels of unemployment to the economy at large, increased homelessness, increased unemployment. And so really now having a foundation of research guiding COVID policies, really striving in our county to ensure that we are not having unnecessary collateral damage through COVID policies. And that's why you'll continue to see Marin County relaxing policies, except where it might relate to some of those most vulnerable settings. We are going to continue to follow the best available science. And I'm always happy when people share science with me. Our team, we're really fortunate in Marin County, have a team of epidemiologists who are always looking at our own local data, and contributing to the body of science globally, as well as being able to identify critically important research that might inform local practice, and then advocating and sharing with our public health colleagues at the state level, at the regional level and state level. And as I've said multiple times, we really, again, this is a shift from these community level policies and mandates to individual risk management and decision making. And then the last slide. So we are all still a community. This is a contagious disease that transmits from person to person. And that means that we are all dependent on each other, both in private and public settings, to limit the spread of contagious infectious diseases. And our success really just relies on us working together as a community and having communal action. It starts from staying at home when you're sick, not going back to school too early. I'm going to really reinforce that. One of the things we've consistently been seeing and hearing from schools is that parents have a child with symptoms who may or may not have had an exposure to COVID-19. They complete a test right away, and the test for COVID-19 is negative, but the child may still be symptomatic. We really would encourage those students to stay at home until their symptoms are resolving and make sure they're symptom-free before they're going back to school. If there's been a known exposure event and you have a negative test, to consult with your healthcare provider before sending your student back to school. And we really appreciate that a lot of parents depend on school for being able to work, and that we are all, again, we have that mutual dependency of school supporting our economy by allowing us to work. But at this point, with such high rates of COVID-19, like I said, we're on that right side of the mountain coming down. But as everyone who climbs mountains know, your greatest risk for injury is when you don't have energy and you're descending down that mountain. And so we still have very high rates of COVID-19. So if someone does have symptoms and they've been exposed, and even if that first test was negative, they may have tested too soon, I'm really encouraging people to stay at home and consult with a healthcare provider. And we appreciate that might be a burden economically to your household, but we, again, still have high rates of COVID transmission. We need to be ready to adapt and respond. We want to relax as quickly as possible, but we also as a community need to be prepared to restrict as quickly as possible and adapt to a new variant if we see conditions change. And just again, recognize there's a spectrum of risk. A 20-year-old unboosted person who has no health conditions and is healthy does not have the same risk of a poor outcome as a 40-year-old teacher who may have diabetes and obesity, or may be battling a new cancer diagnosis. So there really is a spectrum of risk, especially in our school community, where it's not just young children and adolescents who are in the school environment, but we have a diversity of adults from different backgrounds with different health conditions who also have people living in their homes who also may have other chronic conditions that place them at higher risk for COVID-19 infection. So I'm just really seeing that, although as a mom, I'm often singularly focused on my kids and getting my kids to school, recognizing that this is an environment and a school community where there's people from all different backgrounds with all different levels of risk to having a COVID-19 infection. We'll jump to the next slide. And that's it. And I have a really great quote from Alice Walker that I wanted to share that I forgot to provide. Oh, I don't have my Alice Walker quote available to me, but that one was about gratitude. I do have a tremendous depth of gratitude to everyone who participates in these calls and who communicates with me by email. I strive to answer every email that I receive from the community to share the data and evidence that's informing our recommendations and decision making. The quote in front of me is actually by Bob Marley, and I think it's apropos right now, is that free speech carries with it some freedom to listen. And I'm open to listening to the community and learning from you. And I really appreciate everyone sharing their voices and their sense of urgency to move forward in our pandemic response. And hopefully we can move forward just with compassion and kindness, as I think there are many people that are wearied and fatigued and couldn't imagine that 2 years from March 13th, we would still be having a meeting like this tonight. So just really appreciate the strength and fortitude everyone on this call has had during the past 2 years, really encouraging everyone to continue to engage in self-care for themselves and their family, which can still be challenging as we all are still not returned to a normal or even what feels like a new normal. And just to reassure you that Public Health in Marin County remains committed to, again, supporting those environments where students and adolescents thrive, as well as supporting environments where school staff can be safe to work. So thank you all. You're muted.
You'd think after 2 years, I might have practice of that. Anyway, thank you, Dr. Santora, for that very valuable information and for providing all of the background related to where COVID is in our community today, where we anticipate it might be heading. And your guidelines and guidance along the way have been really instrumental in the safe opening and the fact that our schools have stayed open. And so we are very, very grateful for that. And we have some time for questions. And I think I'm going to start with asking you to talk about outdoor masking. There are a lot of questions. There's some confusion about it, especially related to an announcement where the governor is stating that he is going to be relaxing indoor masking. Announcing that indoor mask mandates will be lifted on February 15th. So there's so much about masks right now that's up in the air. So can we start with outdoor masking right now, where it stands today in our community for students at school?
Of course. So there was an announcement from the state that the state order regarding masking for vaccinated persons is going to end on February 16th. That specifically excludes childcare and school settings. So indoor masks will remain required in our indoor school settings. That's a must. There's no exception. There's some exemptions that the state then outlines how to manage students and staff who may have specific exemptions for medical reasons. So under state order, which is under our K through 12 school guidance, schools and childcare will require masks indoors. We no longer will have a county mask order. So we will stay aligned with the state and with the CDC. And what the CDC language recommends, and this is in our 32-point guidance, is that when you have areas of high or substantial transmission, you should consider wearing a mask outdoors when you have close contact with unvaccinated persons. And so what we're seeing across the county, and we support every school and district's differential approach to outdoor masking, is that some schools feel comfortable allowing students to be outdoors masking. And if you've seen an elementary school or even a high school, when kids gather outdoors, they usually are less than 6 feet from each other and eating and talking close together, because that's what is socially valuable for children and adolescents, to be connected. And so some schools feel comfortable allowing their students and parents, and most importantly, it's a parent-driven decision and a guardian-driven decision if they're going to advise their student to wear a mask while they're outdoors, and students should follow what their parents or guardians say they should do. And then then the next is the schools determining whether when they feel comfortable relaxing the recommendations. Right now, we do have high transmission rates. It is possible it's less likely to have outdoor transmission. We do highly encourage that students have outdoor masking breaks. Outdoors are the safest place for students to be. And when we return to moderate levels, that's that yellow level in the CDC guidance, we'll be returning our recommendation where in a more explicit statement that outdoor masking is optional, and in most situation masking outdoors, including outdoor play, recess, and lunch, are not required. We'll be making that update when we return to lower case rates consistent with moderate levels of transmission.
Okay, thank you for that. And the guidelines related to events and groups, how will that impact schools who are beginning to plan for those spring events like proms and other events that will have people gathering?
So I am cautiously optimistic that we will have a wonderful spring season of concerts and events where students are not required to wear a mask. Well, at least we know unvaccinated and vaccinated students would not be required to wear masks. We support schools. Again, schools will be setting their own policy for these events. So they may require vaccine verification, which is recommended as a tool for the state for determining who should be wearing a mask and who shouldn't be wearing a mask. They may also implement testing as another layer of protection, and that would be up to the school level. But I think the vision of all of us on this call is that we'll have graduations without masks, we'll have proms without masks. But that being said, we need to stay humble and be prepared. If there is another variant that creates conditions where masking would be recommended, then that might be a recommendation. But I'm cautiously optimistic that there'll be lots of awesome photos of mask-free events. Cautiously optimistic. But be prepared that some schools may have more strict requirements like vaccine verification and testing. And depending on the conditions, there could be masking requirements.
Does the indoor masking rule apply to private schools as well?
Yes. Any K through 12 or childcare setting in the state of California requires indoor masking. We are aware of some schools that do not follow that. We have referred those schools to our district attorney.
Is there a working definition of what vaccinated means? Is it 2 vaccines and a booster?
So at this time, fully vaccinated means just completing the full series. It does not mean being boosted. They've initiated a new term called up to date. People who are up to date are people who are fully vaccinated and if booster eligible have received their booster. We have seen indications that there may be a change in the definition of fully vaccinated to require booster eligible people to be boosted in order to meet the definition of fully vaccinated, but that I have not seen that definition change at the federal or state level yet. And it may not change, but.
So Mike Grant has been monitoring the questions in chat, or in the Q&A, I should say. Mike, do you have any in there that maybe we have not covered yet?
Yeah, I think, Ken, it looks like you got, most of the questions are around masking, and there was a specific question from a parent of a senior who is unvaccinated. And they are really want to know, will they be able to go, if proms are allowed, will an unvaccinated senior be able to go to a prom? And this may be part of their decision-making process. And, so what is your sense about that?
I think that's where it'll be up to a district or school policy. An unvaccinated student from a public health perspective, depending on the conditions, should be able to attend the prom, and depending on the rates of transmission, there might be mask requirements. So right now, if the prom were to happen today, everyone would have to wear a mask right now. But let's say the state changes and still requires masking only for unvaccinated students or staff in school. If they adapt what is the current state order to future school masking order, then to be prepared that an unvaccinated student may need to wear a mask indoors. Again, I know that seems so close, but it also is far away from a policy decision. But again, I think our goal is for all students, regardless of vaccination status, to be able to enjoy those spring and milestone activities, even though they may need to have additional testing requirements or other requirements that are directed by this district or school policy.
Anything else in there, Mike?
Yeah, there's been a question about a student or staff member who's had a prior infection. They're confirmed COVID positive. Does their natural immunity allow them to have some ability to go to participate in events that would typically require vaccination?
So we consider natural immunity for 90 days after a documented infection. So where events are considered, that would probably be, we would have to discuss that with individual schools. So we don't recommend someone that's had a past infection of COVID-19 within 90 days does not need to have, regardless of their vaccination status, does not need to be quarantined. And we don't recommend testing for them. If, let's say, for example, if it was team-based testing, we wouldn't recommend they be part of the testing because of that high level of natural immunity 90 days from the documented infection date. But if there's a specific, that would be one, if there's a specific practice at a school to contact our COVID-19 school so we can consult with the school. Again, schools can be more restrictive, but we would consult with the school and make sure it aligns with some science-based principles around the natural immunity, which is, again, for 90 days after an infection, natural immunity is very strong and effective. And that's why we've shifted even some of our recommendations around sports, because we were able to field teams with students with a history of natural infection in the past 90 days. So.
Okay, so there's thank you, Dr. Santorum. And then there's one more, and it sounds like a very specific situation where even though masks are not required outdoors, it sounds like this parent's school is requiring masks outdoors. Is that, could that be the case?
Absolutely, that could be the case. As I described, we still have high rates of transmission. A lot of the activities that students engage in outdoors are not activities that allow for physical distancing. They eat close together, they socialize close together. So it would be reasonable for a school to still require outdoor masking because there's a close contact between unvaccinated and vaccinated students and staff. And again, that recommendation from public health will change. We'll be updating our recommendation to align with the more relaxed version of optional outdoor masking, and that in most situations masks are not required outdoors when we hit moderate levels. And that's, again, what you're seeing is us not recreating our own wheel. It's just county public health aligning with CDC recommendations as we have different conditions, and decreasing risk of COVID-19 transmission would further relax recommendations around outdoor masking. So we went from should wear mask outdoors at the end of January 4th to should consider, which further relaxed. We know different schools are at different phases of allowing students to have more free time without masks on outdoors. And again, we support each individual school or district's approach towards their decision around outdoor masking.
All right.
I think that's just an important area to see there. schools, it's not just a school environment, it's also a workplace environment. And again, school leadership are really trying to do their best and balancing both, kind of both constituents, the staff constituents and the student constituents. And we really respect the challenge of doing that. But
okay, well, thank you. I think that wraps up the questions from the Q&A, and it's all about masking. Yeah.
Thank you, Mike. Appreciate that. And Lisa, we thank you for another great presentation, and we look forward to more to come. The next chat that we will have that features this particular group will be in April. It's April 11th at 6 p.m. Unless, of course, there's a need to do a community meeting earlier than that. Of course, we would do that. I want to refer you to the chat tonight because there are some links to very useful documents. And the quote that Dr. Santora mentioned about gratitude is in the chat as well. And it's a beautiful expression of gratitude. And I think one that we all share with each other. So we wish you all the best and thank you for joining us this evening. And remember, this webinar has been recorded and you can access it on the Rethinking Schools website at any time. Good night, everybody. Thank you.